Okay, let's start now. Good morning, good day, everyone. Welcome to the Indonesia Project's COVID-19 webinar series. My name is Arianto Patunru, and I'm hosting this event with Nurkamala Mulyani and Baskara Adiwena. We acknowledge and celebrate the first Australians and pay our respect to the elders past and present. We are grateful for the support from the Australian National University and also the Australian Department of Foreign Affairs and Trade. Today, our topic is gender matters in Indonesia's COVID-19 policy response. The coronavirus pandemic has caused a health and economic crisis all over the world. And while the virus has respected no borders, it has exposed deeply rooted inequalities, including in Indonesia. The government is well aware of the social and economic challenges and has announced massive additional state spending. This webinar will shed light on gender dimensions in the fight against COVID-19 in Indonesia and the path to inclusive economic recovery. This seminar will analyze the situation for specific groups, particularly female health and social workers, households headed by women workers in the sectors hardest hit by the pandemic, and also women running micro businesses. The seminar will reflect on policy measures that hold the most promise and what more may be needed as Indonesia transitions into the new normal. This session is done in collaboration with Prospera. So a little bit about Prospera. Prospera is Australia and Indonesia's partnership for economic development. It is based on 20 years of cooperation and is working with the Indonesian government to help people manage the economic impact of the COVID-19 crisis and to restart businesses and job creation. Prospera is also helping ensure the banking system can cope with the crisis and the tax and budget systems respond properly. We have 4 distinguished guests. The first one is Melissa Wells. She is the Deputy Director for Partnerships, Policy and Performance at Prospera. Melissa leads Prospera's work across policy communication, gender and inclusion, and the public sector. Her career spans work for Australia's Department of Prime Minister and Cabinet, multilateral organizations such as the World Bank, and companies in the resources sector. The second presenter is Bimbika Sijapati-Basnett. She is the Senior Advisor for Gender and Social Inclusion at Prospera. She leads a team of specialists helping integrate gender and inclusion into all that Prospera does. Prior to joining Prospera, Bimbika was a gender coordinator at the Center for International Forestry and has also worked for UN bodies, NGOs, government agencies, and policy research think tanks in Indonesia and globally. And then we have 2 discussions. The first one is Wita Krisanti, Indonesia Country Manager of Investing in Women. Wita is an international development professional with 20 years of experience working with multilateral organizations, bilateral donors, and NGOs. She leads the Investing in Women program in Indonesia, which aims to promote economic growth and gender equality by strengthening employment practices for women and increasing investment in women-led small and medium enterprises. Last but not least, we have Dr. Ariane Utomo Ririn. She's a lecturer in demography at the School of Geography, the University of Melbourne. Ririn's work considers how social change is reflected in school-to-work transitions, attitudes to gender roles, women's employment, and broader patterns of marriage and family change in Indonesia. So as usual, we will have Q&A session after the presentation and discussions. But if you want, you can write your question anytime on the Q&A box, not on the chat box, please. And we'll attend to them in the Q&A session. So without further ado, let me invite first Melissa to start the presentation, the seminar. Over to you, Melissa.
Thank you for the kind introduction, and a very Warm welcome to all of our panelists, and a good morning and good afternoon to all of you listeners. We're really looking forward to your questions and comments, and we really appreciate this being a collaborative seminar as possible. This crisis is different. We've heard that many times, but this crisis is different for women. And that's why we're here to talk about gender matters in Indonesia's COVID-19 response. We open with a quote from Indonesia's Finance Minister, Ibu Sri Mulyani, noting that when we've had a financial crisis in the past, it was the banks or big business that were hit hard. But this pandemic is attacking the grassroots. And that's why when we're looking at the economic response and recovery, we really have to pay attention from those that may have been excluded from government policy in the past, the poor, and also applying a gender lens and dimension into all of the policy making we do. So if we move on to the next slide, I'll outline our presentation today. I'm one of two deputy directors at Prospera and really pleased to share some of our insights. And I'm joined with Bimbika, who's our Senior Gender and Social Inclusion Advisor. We'll talk a little bit about why and how gender matters for the COVID-19 response. And then we'll move on to three areas of government priority, touching on public health, social safety net, economic recovery, and next steps for Prospera. It's a very wide landscape and discussion in terms of taking full account of women's issues in the gender space. We're only going to touch on a few today, and we really look forward to your perspectives also from the audience. So moving into public health, before we move on to that, let's just reflect on briefly why gender matters. Many of you will be across this, no doubt, but it's still worth highlighting the importance. This COVID recession has a different impact on whether you're a man or a woman. In past economic downturns, it has tended to be men that are more at risk of losing jobs in cyclical sectors such as manufacturing, mining, or construction. And women have tended to be more represented in the non-cyclical sectors of health and education. In this time around, it's affecting services industries, and some of the hard-hit sectors like tourism, accommodation, hotels, trade, are where women are working. The gains in gender equality are at risk of being reversed. Just as economic gains are at risk of being reversed, we heard that Indonesia's GDP for the March quarter was down 5.3%. Incomes are facing a setback, so too will gender equality. But it doesn't have to be this way. Looking forward to a path to inclusive recovery, we are all looking to help Indonesia in its policymakers set on a path that is more prosperous, more prepared, and more equal. So if we move on to the health dimension, we are, of course, an economic development program, but we do need to recognise the impact of the health crisis associated with COVID-19. So the angle that we take is to look at the breakdown of the workforce. And in Indonesia, as in many countries, women make up 2/3 of health and social service workers that will be caring for people that may fall ill with COVID-19. And in the category of doctors and nurses, women have even a greater share at 3/4 of the workforce. So women are on the front lines fighting COVID-19. And onto the next slide. There is a risk that women health workers face higher exposure to risks. And on the left chart, we look at insurance coverage of health and social workers. You can see that health protection has the highest coverage overall, and that's in part due to Indonesia's social contributions from the government to health insurance, but it's still not 100% coverage, and it is lower for women. And there are lower rates of coverage for disability and death protection. So this means that frontline health and social service workers could find it difficult to pay for their treatment if they become sick themselves. Looking onto the right-hand chart, there is some analysis emerging in other countries that COVID-19 infection rates are higher among women health workers. This may be due to the high representation of women workers in the workforce at large, but also may be due to other factors such as commuting patterns and workplace safety. We don't have that same information for Indonesia, but it just highlights the importance of something to monitor and the significance of sex disaggregated data in looking at the response to the crisis. If we move on to the next slide, this is a regional breakdown of the insurance coverage, and showing that in some areas such as South Sulawesi, where there is quite a high prevalence of COVID-19 along with Java Island, there are low rates of full coverage of insurance protection. Now, the government is well aware of many of these issues and has announced a health sector package which provides income supplements as well as additional coverage for health workers. There are some gaps, however. It's earmarked for health facilities. And if we go on to the next slide, there are also many instances of women likely to be caring for people in the community and at home, not always in a health facility. This reflects the gender division in labour, which we see quite prevalent in Indonesia. The labour participation rate in work outside the home in paid work is the gap between men and women is amongst the highest in Southeast Asia. In the last Susanas in August 2019, it's about 52% workforce participation for women and about 85% for men. It also, you can see in the right-hand chart, that particularly in urban areas, women's participation in the formal workforce does tend to drop out after marriage and childbirth, where they take on the primary caring role. So that's again something for us to keep in mind as we look at the economic impacts of the pandemic. If we move on to the next one, Bimbika. Policy to protect and empower women we would suggest looks at safe working conditions and appropriate equipment, but also prioritising gender equality in health systems, whether that's the COVID-19 response, and secondary effects, knowing that women are still going to come into contact with the health system to give birth, for example. And we know that even before COVID-19, Indonesia had a higher rate of maternal mortality than its neighbouring countries, a much higher rate. So that's something to keep attention to. In terms of where this intersects with some of Prospera's work, one of the issues impacting on health disbursements or the response, and the President has highlighted about a month ago that health expenditure was only 1.5% of the target for this year, and that has started to move a lot more quickly now. But there have been budget and administrative rules in this decentralised nation that have impacted on the quick disbursement in a crisis. So, for example, the Finance Ministry officials identified that hospital procurements were being slowed down by the need to verify back at central level. These are important rules that are in place in normal times, but this is a crisis and not a normal situation. So the government has looked at ways to streamline the administration and also having verification at lower level to help speed up the response and protect workers. The next section that we'll touch on is the social safety net. Firstly, an important dimension is that school closures have compounded women's unpaid work. 1 in 3 Indonesian households are affected by these school closures. And you can see in the left-hand chart, which is looking at some of those hard-hit sectors, about 40% of women working in those sectors would have a primary school-aged child that is now doing learning at home. UNICEF estimates about 60 million Indonesian kids are now in home learning. This is compounded by women single earners who now face the difficulty of caring or helping their children to learn at home and sourcing outside income. And for 1.7 million households, they have both children that are school age and elderly relatives to care for, compounding the issue. Next slide, thanks. In terms of these hard hit sectors that I've mentioned, Prospera analysis indicates, as we've mentioned, that it's the health and social sector that's faced an enormous increase in demand, but a downturn has occurred in hospitality, in the trade sector where women have large shares of employment, and some parts of manufacturing hitting women in garments and textiles. And in terms of the occupational status, women tend to be less represented in the employee category, with the likelihood of better protections in the workplace, and higher represented in the family worker category. And across the board, both men and women in the self-employed category and casual workers are facing challenges during this downturn. As part of our policy work, Prospera interviewed women workers and also micro-enterprises we'll talk about a bit later, both at the onset of the crisis and also more recently. And so these case studies are illustrating workers at risk. Ika is a 31-year-old single mother with a daughter, and she works in product assembling for a large multinational firm. And she indicated that since the pandemic, orders from the multinational company had declined dramatically. There's no more overtime, or annual leave has been cut short. Recruitment has stopped and staff in training have been laid off. She's hopeful that the pandemic will be over soon and orders resume. But if the situation's prolonged, she is concerned that even permanent staff will be the next in line for redundancies or stood down without pay. She doesn't know how she will cope because she's not in line for many of the social assistance programs. And Juju is a 41-year-old female factory administrator. And in the company she works at, there's been a sudden halt in export sales. All of the destination countries are in lockdown. The production is only for stock inventories. The employer has already laid off daily workers, and permanent workers are facing a cut in wages. She's contemplated setting up another business to cope, but knows that business opportunities are very few and is worried about losing income. So in terms of the government response, there have been a raft of measures around social assistance. We won't talk too much about those measures here today, but just noting that there have been expansions of the cash and food aid, free electricity for the lowest income households. But we'll touch on one scheme, the Kartu Prakerja scheme, which relaunched on the weekend. This is a presidential priority and led by the Indonesian government. And Prospera was asked to assist in some of the preparatory work for the project management office and also the policy. It was originally to be a staff training, workforce training program, but it was repurposed with COVID-19 to also give income supplementary support and to reach informal and self-employed workers. This scheme is an on-demand registration scheme, so it's a bit different to the other social assistance schemes. It has faced unprecedented demand. In the first 3 batches, there was over 9 million applicants. The government had originally set aside about 5.6 million positions for this scheme. So demand is high, and the government is continuing to strengthen procedures and adapt the scheme in response to the market. And in terms of applying a gender lens to this scheme, there are some ways that it could be improved to ensure that it is reaching women workers. These are just suggestions that Prospera is looking at, but to highlight some of the dimensions, if we look at the eligibility criteria for the Kartu Prakerja scheme, which is over 18, not in school, or not already receiving a social transfer, about 37% of the participants would be women. So this is something potentially that a monitoring committee could set as an internal benchmark to check if there are in fact about 37% women participating in the scheme. And if not, why not? It may be a challenge to reach women and something may need to be tweaked with the scheme. And in particular, when we look at access to internet by gender and age group, we can see that there's a dramatic decline in internet access among the older age group. And around the middle years and the older years, there is less access for women compared to men. So again, considering the ways that this online system is reaching the population that it's serving. But we've been very impressed with the government and the project office in terms of continually adapting this and other social assistance programs as the crisis unfolds. I'll leave it there for the discussion of public health and social safety net and hand to Bimbika, who will take us through economic recovery and also zooming in on women micro businesses. Thanks, Bimbika.
Thank you,
Thank
Melissa.
you. Should I continue?
Over to you, Bimbika, sorry.
Yes. Thank you so much, Melissa. So I will continue on from where Melissa left off. Okay. So as you can see on the left-hand side, approximately 90% of Indonesia's workers make a living at medium-sized, small, and micro firms, often in the informal economy. Supporting these enterprises to survive is crucial for livelihoods and also for Indonesia's prosperity and recovery. Owing to their small cash reserves, limited inventories, and difficulties in taking out loans, many will struggle to survive the pandemic and the resulting economic shocks. According to data from the Ministry of MSMEs and Cooperatives, over 98% of the firms are actually micro, but the category of micro is really broad. So we've reclassified them into 3 categories, and you will see that on the right-hand side: the survivalist, growth-oriented, and those in the middle. We are using the survey Micro Small Enterprise 2015 and a conceptual framework suggested by the social economist Naila Kabir. In our reclassification, we have linked business profit with household welfare. Very briefly then, survivalists are those who are operating businesses for individual or household survival with a monthly profit of less than 1.4 million. This is barely enough to keep a family of 4 out of poverty. Growth-oriented are larger businesses with better prospects for future growth, and we estimated these to be having a monthly profit of about 5.12 million. And the middle are those in between the two, running a margin between 1 and 4 times that of the 2015 poverty line, multiplied by the average number of households. Here we find that the survivalists are about 54%, middle is 32%, growth-oriented are 14%. And using these definitions, it will help to make sense of these graphs. As you can see, women make up a great proportion of businesses in the survivalist category, and 71% of all women businesses are concentrated in this category. We followed this analysis with, as Melissa mentioned, pilot interviews of women businesses. We had previously surveyed them in 2019 as part of our broader work on ease of doing business for women in DKI Jakarta, which I will be discussing quite a bit during the course of this presentation. And the quotation that you'll see on the left-hand side reflects some of the sentiments that will relate to us. My sales have gone down to 0 because all bazaars and events have either canceled or postponed. I've tried to make handicraft products online through WhatsApp, but to no avail. Everyone is prioritizing food and basic needs. So before we deep dive into the women-led businesses, let's step back and talk about the broader context in which these women are finding themselves due to the current economic and health crisis. In traditional downturns, the informal sector serves as a buffer to negative shocks, temporarily absorbing the workforce pushed out of the formal sector. And there's considerable evidence on the role that informal sector has played in Indonesia after the 1998 financial crisis, for instance. But this current pandemic is fundamentally different, and particularly for those who are barely making ends to begin with. In a recent piece of work, Lacavone and colleagues at the World Bank have proposed a framework for understanding the current crisis for microbusinesses, which we found to be particularly useful for making sense of what we were finding through our interviews as well. The nature, severity, and sequencing of these shocks obviously vary, but they are illuminating. So first and foremost, if you reflect back on the quotation that I had shared earlier, is the shutdown shock. Suddenly all economic activities come to a halt for those, especially operating in public places, markets. They are not able to earn income at all. And in the new normal, the latter interviews that we've done, people talk about demand shock, the slow demand for sales because customers are staying at home, customers have low purchasing power because of layovers and job uncertainties that they themselves face. For businesses that are selling handicrafts or selling niche products that were quite profitable before, they found that people's priorities have shifted and they're no longer interested to buy their products. On supply shock, women spoke about price and lack of availability of inputs. Even when they are available, the very high transaction costs that they suddenly have to incur in pooling together the needed supplies from multiple sources. On the financial shock, even profitable or more growth-oriented businesses had to draw on savings, had to sell off assets to prioritize consumption. And the uncertainty shock, even in new normal, they felt uncertainties remain. There is little confidence on when businesses will return to normal. This makes it very difficult to make decisions about the future, whether to restart, to work as normal, to take out loans, if their ability to pay is uncertain. Because of these uncertainties, they suggested that they become much more risk averse than they would otherwise. During the early days of the crisis globally, there was quite a lot of discussion about what's the right policy approach for micro businesses, particularly those who are poor and operating informally. And I'm only going to reflect on two. Some were of the view that the boundaries between business and household is blurred. The most important focus must be on prioritizing adequate social assistance. This is because micro enterprises have low entry and exit costs. This is not a natural disaster where their assets have been destroyed. They can resume once a pandemic is over. Others in comparison pointed out there's considerable heterogeneity among the micro enterprises themselves, as we ourselves have reflected through our analysis earlier. And lessons from previous crisis response suggest that even small injection of cash at the right time can support long-term recovery. This is a point that we would also subscribe to, that they would need this additional support. So let me explain the logic here. Indonesia has introduced a series of social assistance and dedicated support to poor and vulnerable groups to cushion the shock, as Melissa mentioned. According to our analysis of the socioeconomic survey, those in the bottom 40%, at least half of them are also self-employed. But when we looked into the consumption profile of this group, the amount that they were entitled to receive was barely enough to cover their food expenses, let alone find funds to set aside for business purposes. Then there's also the additional challenge of reaching people who need the support, and many in this group were not receiving assistance back in 2019, and hence most likely aren't in government social registries. The government has also introduced a series of support for micro and small businesses, as you know, from tax deductions, credit guarantee scheme, subsidized credit, and many more. But we found it would be difficult to reach micro businesses operating informally with those schemes because these businesses don't necessarily pay taxes. They would not have the document needed to be able to access the schemes. For instance, I will not dwell on this slide, but very few had external credit in the first place. Loan uptake for women was even lower than for men. And we found similar results in our other analysis that we've done on businesses in Jakarta. During our interviews, when we inquired whether people would apply, so these are the latter interviews that we've done recently, the following quotation reflects the unwillingness to take loans because of this uncertainty shock that I discussed earlier. I believe my business can recover if I'm able to sell a variety of products in my shop. But right now, I will think twice before I take up a loan. In this regard, the recently announced Bansos Productive is promising in that it fills this current vacuum and specifically targets micro businesses operating informally. So far, the government has announced that around 12 million micro and ultra businesses would receive assistance of 2.4 million each. And recipients are those who have not received any other loan prior. Yesterday, during the Gotong Royong Jaga UMKM, or Coming Together to Protect Medium, Small Micro Enterprises, Ibu Sri Mulyani, Indonesia's finance minister, specifically acknowledged that women micro entrepreneurs have been impacted by this crisis quite a bit, and this program could be beneficial to them. The biggest challenge will be in identification and reach, but we understand from yesterday's discussion, the final details of the delivery mechanism are being worked out. So Prospera had joined hands with a number of others to recommend providing the capital to businesses. Minor details are being worked out, recommending additional consideration. We go through and we made fourfold recommendations that you see on the left-hand side. So first is the capital grant to help businesses restart, which I've discussed quite a bit. The second is the loan uptake for capital grants recipients who need extra credit because they need additional capital needs or because one-time cash transfer is not enough for them. The third is the one-stop shop information where they can find all the information that they would need to access the support and channel any concerns. And finally would be the wraparound business support for women. We are of the view that gender needs to be integrated across, and there needs to be specific gender support for women businesses. We think it's important to monitor uptake and be ready to set benchmarks for women if the uptake has been slow, for instance, and ensure that both men and women's feedback are used to share the information about benefits that are available. And the tailored support, including mentoring, coaching, the soft business support, is particularly important, and there are a wide range of existing providers who can provide that link. And the reason why we're recommending these integrated and specific measures is because of lessons from other countries and our work and those of many others, including recognition from government representatives as well. In Sri Lanka, for instance, after the tsunami, a randomized control experiment was done to study the effect of receiving capital grants to micro businesses on business recovery. And you will see the results on the right-hand side. 2 years on, the study found that those who'd received grant had recovered, whereas others who had not, had not. But the same study found that there was gender differences. Male-owned businesses recovered more than female-owned businesses. And this illustrates well that just offering capital grants for both men and women might not be enough, and it could also be accompanied with additional measures. This point was also echoed quite a bit during the Gotong Royong Jaga UMKM by representatives from Ministry of MSMEs and Cooperatives, as well as the Ministry of Women. And furthermore, our own work on microbusinesses in Jakarta, as well as more recent work by JPAL, Center for Global Development, joint work by them, World Bank, finds that when access to finance is combined with soft skills, then it can improve outcomes for women. So what are next steps? As Melissa mentioned, we've been supporting with the new normal, how to ensure there's prosperity, there's equality, and there's inclusivity in recovering with that overall sort of approach in mind. And there are 4 things that I would like to very briefly highlight. So first and foremost, we are supporting to embed a gender and social inclusion lens across our work program and any support and advice that we provide. These have ranged from supporting to ensure gender and social inclusion issues flow into medium-term budgeting processes on social assistance, public health, economic recovery, to supporting with the development of a new digital literacy strategy, which takes into account the differential access that women have that Melissa also spoke about. Second, as our analysis and those of many others have shown, one of the key barriers to economic participation is unequal division of labor. And here we're partnering with the Indonesian Coalition for Women Empowerment, some of their private sector companies, Center for Inclusive Policy Studies to undertake an assessment of market for non-parental childcare and what role private sector companies can play in providing childcare to both attract and retain new talent. We are sharing this analysis we plan to share this analysis with both government stakeholders as well as private sector associations for wider uptake. Second, since 2018, we've been supporting the Jakarta government to do a gender evaluation of a series of reforms they've introduced on ease of doing business in Jakarta. And last year, as part of this work, we had surveyed over 3,400 randomly selected businesses that had registered a business using a home address. And now we're looking into doing some experimental study based on that work. And the idea is to use this as an initiating pilot project that can later be scaled up. Finally, we're looking into joining hands with a number of development partners to carry out a nationally representative sample survey of the effects of the virus on poor and vulnerable to inform medium-term policy making through process. And here, our efforts are basically to consolidate efforts, to use national systems to avoid duplication. There are many logistical challenges, of course, and hopefully we will have more to share soon. So on that note, let me just briefly recap what we've discussed so far. Let's just reflect on where we are now and what the road ahead looks like. Until the health crisis is resolved, the economic disruptions will continue. And even after the health crisis is resolved, because there is an effective vaccine and is fully rolled out, the current social and economic scarring will take a long time to recover, if at all. The scarring has been immense. People have lost lives, lost loved ones. Even if they've recovered, their long-term health is uncertain. And jobs have been lost, businesses have been shut down permanently, and emerging generation has not been able to learn. And those who've lost their jobs have not been able to retrain to find work elsewhere. And far from being the great equalizer, the virus has really exposed the deep social and economic cleavages the world over, including in Indonesia. And because of all of these reasons, welfare and well-being has to be central to the healing process, whether it is public health or socioeconomic recovery. So a string that links all that we've discussed so far is precisely welfare and well-being. And during the course of the presentation, we've visibilized the role of different groups of women and the differentiated challenges that they're facing during this unprecedented time, as frontline carers in the health system, as well as in the home, as workers and micro businesses supporting the economy. So acknowledging and addressing their challenges is central to the welfare and well-being of themselves, their families, and at the aggregate level to the economy as a whole. From the public health perspective, we've highlighted the role of women in fighting COVID-19 in formal healthcare facilities, as well as in the homes. The risks that they're exposed to, the cost that these risks bring to the goals of prevention and treatment of the pandemic. So addressing the risks by compensating them adequately for their work, full insurance, childcare are some of our recommendations. And second, the COVID-19 crisis have highlighted the role of an effective social protection system to cushion the already poor and vulnerable when the crisis hits. This includes the ability of the system to flex itself, both horizontally by reaching more people and vertically by increasing frequency and delivery of social assistance. And here we have highlighted the need to account for gender disparities in wages and benefits, access to economic opportunities, unpaid care work, in both ramping up the system and the delivery mechanism. And finally, we've highlighted the important role that women play as owners of micro businesses and the support that could be on offer to see them through the pandemic. So thank you for listening to us. What we presented is a collective work of the whole team. Any mistake in delivering would be mine and Melissa's. So we would welcome any feedback and insights. Thank you very much.
Thank you so much, Melissa and Bimbika. That's very comprehensive and interesting presentations. So let me repeat again to the audience that you can write your questions on the Q&A box. I've seen a couple of those there, but we will attend to all the questions after the two discussions. Also, you can later raise your virtual hands, and then we will ask you to speak your question out. We have 120 participants now. Let me greet our colleagues from Department Keuangan, Ministry of Finance, Australian Embassy, also ADB, Asian Development Bank, Universitas Indonesia, and many others. Also welcome my teacher, Professor Meling Oigardiner, also Professor Terry Hall, and others. Okay, so let me now turn to these discussions. Our first discussion is Wita Krisanti. So over to you, Wita. I think Dodi, my colleague, will share your presentation to the audience. Over to you.
Yeah. Thank you, Pak Aco. So good morning or good afternoon to the participants. It's a delight to be here. So the presentation is going to be further zooming into the impact of COVID-19 on private sector companies and WSMEs. There are no surprises in my presentation, and it's confirming Prospera's findings and what we have actually known and experienced in our day-to-day life. So what do we know from the past? Next slide, please. So it's well established in the literature that women and girls are significantly impacted by the economic shocks compared to men. So it's influencing all aspects of their life in terms of like economy, employment, politics, health, and also education. So these outcomes, or the negative outcomes, are compounded by lack of women's participation and leadership in the response and recovery stages. And despite of the best attempts to include gender mainstreaming and analysis in the response and recovery, we are still witnessing the lack of analysis around those strategies. And these outcomes will impact on the long-term negative outcomes on human capital formations and also economic security that will also in turn negatively impact on the overall human development index and economic growth. So what we have achieved today will be set back significantly. Next slide, please. So it's already acknowledged that COVID-19 is not gender neutral. So physical, cultural, and also social differences between men and women are different, and it depends on how vulnerable they are, comorbidity, and also protection issues experienced by women and girls. So with the implementation of large-scale community quarantine or PSBB and physical distancing measures, social and physical vulnerability among girls and also women are increased. This is due to the risk of infection, as already mentioned by Prospera, against the frontline healthcare and also associated workers, restrictions on trade, and the sudden return to the household and intensification of unpaid domestic and care work, which in turn might result in increase of gender-based violence at home. But there is also emerging opportunity for healthcare sector and also digital economy. Next slide, please. So what are the impacts on private sector? So this is based on the employee survey undertaken in May, investigating the general and gender-specific short-term impact of COVID-19 in terms of work, household dynamics, and mental health. The respondent survey are those who remain employed during the survey period, and we surveyed 600 respondents with a gender balance, and most of them informed that they were the main income earner within the families. And the employer survey also taken during the height of the PSBB period, and we look at the impact of pandemic and also challenges faced by employers, in particularly their commitment to gender equality during the crisis. So all the companies reported that they had an existing commitment to gender equality in the workplace, and later we see like how they maintain their agenda on that. So next slide, please. So here's the key findings. Most respondents reported that their jobs had been affected. So it's either hours and pay reduced, pay cut, and job suspended until further notice. So in terms of like work from home arrangement, more women work from home than men, and men still have the ability to work from their usual workplace. And both women and men reported increased time spent on housework during COVID-19. And interestingly, nearly 80% of respondents reported that they were able to be equally productive or more productive during the pandemic. Next slide, please. So this is the impact on work as already presented by Prospera. Healthcare is the most affected. Healthcare are the least affected, and also social work least affected, and manufacture, tourism industry, and in this case, education and training are the most affected by the pandemic. So demand as well as workload for personnel in this sector have significantly increased, and hence they are facing higher health risks. Yeah. So what's the impact on the employment change by gender? So more than 50% of respondents across the board reported changes in their job, with statistically significant differences by gender. In this case, women are more likely to experience reduced hours of work compared to men, whereas men are more likely to report a cut in pay compared with women. In terms of reduced hours, slightly more women experience a decline in hours of work, and slightly more men experience an increase in the hours of work compared to women. Next slide, please. Yeah. So, change in income. Women earn less than men in the workplace, and this exacerbates the situation in the pandemic situation. And slightly more women reported a decline in income. In terms of change in locations, more women reported that they have to work from home, and more men reported that they can continue to work in their normal workplace. So in general, both women and men feel that they are being more or equally productive during the pandemic, but more women significantly felt that they are more productive than before the pandemic, and on the contrary, more men were more likely to feel less productive during the pandemic. The main reasons are quite similar for both women and men for declining productivity. The top one is anxiety and stress, and then inadequate facilities for working from home, such as internet connection and also office space. And both women and men also feel the pressures of increased domestic load. Next slide. Yeah. With the implementation of PSBB, employees feel increased pressures on finance and also domestic and care workloads. Both women and men reported feeling more domestic pressures due to the pandemic, with as no surprises that more women feeling the pressures compared to men. Next slide. Yeah. Okay. So from this, sorry, it's probably not very clear, but I'll provide the links to the survey later. So majority of respondents devoted most of their time for food preparation and cleaning, and overall increase in time spent on cleaning and food preparation is happened during the early months that shows significant health concern and shift to work from home. So, but gender-specific analysis shows significant changes in time allocation for men and women in for activities in which more women reported increase in time spent on the preparing food, shopping, and childcare, and more men reported an increase in schooling and childcare. So changes in the time spent on household activities during the pandemic must be understood in relation to the distribution of household work pre-COVID-19, in which we understand that the domestic work is heavily skewed towards women, women who spend most of their time on household and care work, even when women have jobs. Next slide, please. Next slide, please. Yeah. So impact on health well-being. So it's a physical and also health impact. Both women and men feel their physical health is negatively impacted by the pandemic, and higher proportion of women reported exhaustion from the increased domestic burden, while for men it's their inability to exercise and risk of infection, as well as underlying health becomes their main concern of the physical health. Next slide, please. So more than 1/3 of respondents reported that the crisis had a negative impact to their mental health, with women feel the pressure more compared to men. Next slide, please. So for men, the concerns about around family issues become their main concerns about their mental health. Next slide. So this is the employer's from the employer's perspective. So most of the employers said that financial impact and disruption of support of supplies are the impact of the COVID-19, and they said that they did not feel that women and men were impacted, like affected differently by the crisis, and majority of the companies said that they would remain committed to the same or increase of the gender equality, but acknowledge that the crisis would negatively affect gender advancements in general. Next slide, please. So this is the challenges for the businesses. So they said that the decline and the customers and affect to the business partners, and also a supply of raw materials. Next slide, please. So what are the employer responses for their employees? So the most common responses are from allowing employees to telecommute or work from home, and providing technology required to work from home flexibly. So they still require the employees to operate from their normal workplace, responded with providing employees with sanitizers and other PPE equipments.
3 minutes, Wita.
Okay, next slide, please. So this is the business opportunities for not only for the employees, but also for the employers. So IW's study shows that nearly 80 respondents feel they are equally productive or more productive. So this is a good opportunities for companies to mainstream the new employment and arrangements. However, this requires companies to better manage performance, identify talent, and develop leadership. So they need to look at the new ways of doing business to accommodate the employees' wishes to work flexibly. This means that they need to focus more on the outputs, not the process. Focus on the results, and also acknowledge that there are different domestic arrangements for men and women, and hence tailor the support to the employees. We also found that there is also opportunity to expand the business into other sectors such as textile manufacturing. They shift their business into manufacturing PPE and masks and also other medical supplies. So this is what employers and government do differently in acknowledging in responding to the COVID-19. So the transformational policy is not only for the government, but at the company level, they can also do like a transformational policies that allow women and men to remain productive during the pandemic. Next slide, please. So this is the impacts on the WSMEs. This is what happened at the macro level, the challenges faced by women, small, medium enterprises during the pandemic, and quite similar challenges faced by the private sector, although it's in the smaller scale. Next slide, please. So this is this is the challenges faced by the WSME supported by IW. The current theme is quite similar to what happened at the macro level, which is a slowdown in operations, disruptions, and also logistical delay, difficulties in finding raw materials, and also liquidity constraints. So the impact investors, we also work with impact investors, and they also have challenges in closing new deals, so no investors are interested to take new investments, maintaining relevance, and also immediate priority on survival of this existing portfolio. Next slide, please. So this is what we do as a response to the crisis to our WSMEs. In the stage 1, we have emergency relief facilities providing support to the existing partners, WSME partners, with the objective is to mitigate short-term liquidity constraints by the COVID-19, and the stage 2 is resilient facility. So we aim to support new WSMEs in ramping up investing activities and recovery, and providing seeds funding for new enterprises. As now there are a lot of opportunities also growing for women to work from home. Okay, that's my last slide. Thank you.
Thank you so much, Wita. So let's just go straight to the next discussion. Ririn, over to you, Ririn. Yeah.
Okay, so thank you so much, Melissa and Bimbika, and also Mbak Wita, for your comprehensive and thought-provoking presentation. I'd like to begin.
Would you like to turn on your video?
Video? Oh, sorry, I thought I was on. There you go.
Thank you.
So I'd like to begin by acknowledging the traditional owners of the land, the Wurundjeri people where I work and live, and extend my respect to their elders in the past and present. So that was a really comprehensive presentation on gender matters in Indonesia's policy response to the global COVID-19 pandemic. I'd like to stress the word global here, because it's important for us to remember that there are many parallels in the ways in which the pandemic is amplifying multiple dimensions of inequalities in Indonesia and in other parts of the world, including Australia. So as a discussant, I'm going to use this comparative lens to raise 2 points. The first one is a comment on school closures and its gendered effects that was already highlighted nicely by Melissa and Bimbika. And the second is a series of related questions on gender and labor market regulations in the COVID and post-COVID context. And I'd like to pose this question not only to the panelists, but also as a pertanyaan pemantik diskusi. That is a question to spark a broader discussion, debates, and conversation among ourselves, perhaps during and long after today's webinar. So my first point is a comment on school closure. Melissa and Bimbika had highlighted how school closures compound women's unpaid work. Now, out of the many different ways that the government has responded to the pandemic in Indonesia and in Australia, one really striking difference is on the policy around school closure and remote learning. In Melbourne, where I live and work, the state government's decision to close and open schools are closely associated with broader restrictions on mobility and economic activities. So since March, we actually already had 2 chunks of very brief periods where my kids went back to school. But what we have seen in Greater Jakarta, at least, is that despite the so-called new normal and resumptions of economic activity, opening of restaurants, returning to work in the office, schools have been pretty much closed since mid-March. The decision to continue closing school, in my opinion, is likely to be the right decision from a public health perspective. But this rests on the crucial assumption that there would always be someone to look after the kids at home. And presumably, on the back of the policymaker's mind, this someone is the mother. When we look at trends of decreasing household size and a trend in household structure and living arrangement, which has shifted away from the extended family co-residence model to nuclear family households in urban Indonesia particularly, we can imagine what the strains of having kids at home would have on working parents, right? Working mothers in particular. So taken together, what COVID-19 has really underlined is that not only women's care work has been undervalued, but women's paid work, right? Their economic, monetary contribution, intellectual contribution as frontline workers in the healthcare sector is also implicitly undervalued. When they do work, working women, working mothers are expected to be or seen as secondary earners in the household by the government. And we see this across other regulations in Indonesia as well. For example, when it comes to treatment of women in income tax. So I do acknowledge that it's very difficult for the government to weigh up these pro and cons about school closing and opening of schools, opening up business activities and so on. So this is unprecedented time, and I acknowledge that it's a very difficult question for us to think about. My second point is a series of related questions to the panelists and perhaps to the audience in the room as well. So in light of the policy recommendation by Prospera, and also thinking about this collective uncertainties and our struggle mental health-wise, mentioned by Bimbika and also by Mbak Wita, I would like to ask, how can we really promote a much more inclusive labor market in post-COVID Indonesia? A labor market that would provide men and women with equal opportunities for a decent, meaningful, secure, right, and upward mobility enabling jobs. Would the Omnibus Bill help us to achieve such goal? And this question draws on what we have witnessed so far in Melbourne, where we are seeing an intersection in the geographic distributions of populations with precarious positions and insecure work and COVID-19 hotspots. Some people have pointed to the ongoing trends towards labor market flexibility of casualisasi, contracting at work, as one of the key factors behind the hotel quarantine debacle in Melbourne, and a plethora of outbreaks in workplaces here in Victoria that heavily relies on casual work. This pandemic has really made me think long and hard about a very difficult question. What are the long-term impacts of policies aiming to promote a more flexible labor market on one, inequalities in the labor force, and two, the well-being of women and their families in Indonesia? That is to say, if we were to have an inclusive development as the final objective, what is really the point of trying to move Indonesian women workers away from the informal sector when many of the jobs in the formal sector are increasingly informal in their characteristics? So that's my 5 minutes. Thank you.
Thank you so much, Ririn. So there are some questions also from Ririn, if you noted, but let me collect questions first, and then Melissa and Bimbika, also probably Wita later, can also comment on the points that Ririn raised. So in my list, there are Stephanie Hayes, Cherry Hall, and Titi Anas. Stephanie, are you there, or do you want me to read your question?
I'm here. Thank you.
Okay, go on.
Yeah, my question was about how that women in rural areas are actually having access to these bansos, which has been mentioned before, or whether this is just a program that's focusing on Jakarta. Maybe I missed that point. And also the other question was, how can 2.4 million one-time payment really make a difference for a small business that has probably not been making any profit over a couple of months and won't for the next couple of months neither? Thank you.
Thank you, Stephanie. Let's ask Pak Terry for his question, and then maybe you can respond to those 3 questions, including Ririn's, and then later on we collect from Mbak Titi and Pak Budi Rasa Sudarmo. So Pak Terry, over to you, Pak.
Thank you very much, and thank you to the speakers who not only had wonderful presentations, but also great backgrounds to look at. I have 2 questions, actually. One is related to the map of Indonesia, which Melissa presented, that showed quite significant differences between provinces and basically a west to east divide, with Eastern Indonesia seeming to be in a much less effective space for dealing with COVID at the moment. And I'm wondering whether, in addition to thinking about the gender policies that you have proposed, we should be thinking about geographic differences, because some policies may work well in Jakarta and be totally irrelevant in NTT, NTB. And so I'm wondering whether you want to reset your policy framework in a broader framework. The second point, when we're talking about all of these issues of households, and I really appreciate Ririn's comments about the growing proportion of nuclear families and people who are dealing with much smaller families. We also have, as we know, sometimes single parent families and so forth. I'm wondering about the role of the BKKBN and the Ministry of Health. Looking back over the last 40 years, the BKKBN and the Ministry of Health have had institutions like the Posyandu, and the BKKBN has a whole series of institutions that they have used for training at the community level, both to deal with issues of childcare and even aging. And I have not heard anything from the BKKBN in the COVID space. And I would have thought that they would be leading in the areas that you're interested in. And I wonder if you might say something about whether you've heard from the BKKBN. And finally, just the financing question, where you give money to small businesses run by women or run by men. The BKKBN had a small credit scheme, and they had virtually 100% repayment. The women who were running, using the credit, were extremely responsible. And by contrast, the Department of Agriculture ran a similar scheme where they gave money to men. And they found that a lot of the money that the men got was gambled away or drunk away. And it turned out that the women, with their BKKBN profits, were paying off the debts of both themselves and their husbands. This was in Lombok and
when was this, Terry?
This was in 1998, 99, 2000, right up through 2005.
Right.
There's lots of reports on these sorts of things, and I think we need to revisit them as we're thinking about the absolute need to have finance available to people and social support available to people caught in this pandemic.
Okay. Thank you, Pak Terry. So brief response from each of you, starting from Melissa.
Thank you for the question. I'll cover a couple of them and then pass on to my Bimbika, particularly on the microcredit questions. So firstly, in terms of Ririn's wide-ranging question about the labour market response, both during COVID-19 and then beyond. Firstly, I think it's important to recognise that there are additional measures needed for this crisis. There is no labour market protection system that can cope. So whether it's in Australia where they've instituted the JobKeeper payments, pandemic leave, also supplementary income support, and in Indonesia recently announced income in job subsidies for those earning under 5 million a month or less, which is higher than the minimum wage, but still in the vicinity of people needing additional income support. Those measures are needed during this extraordinary time. But then going forward to the longer labour market issues, again, the starting point in Indonesia is that it is already a labour market. And as Ririn has pointed out, informality could be as up as 60% on Prospera's estimates. That's people lacking a contract for work and working in an informal setting without protections. So part of what the government has been looking at with the job creation omnibus that covers a wide range of issues around investment, licensing to kickstart the economy is also the labour market issues to try and create a field where people can go into more formal jobs to access protections. And certainly we as policy advisors would be looking at the areas to ensure that those protections are there as well. And one of the proposals for the first time in Indonesia's history is to have some sort of unemployment insurance scheme to protect more workers alongside that. On the issue of the difference across Indonesia that Terry has raised, we completely agree. There will be national policies that they need to be right-sized for regions. Part of the issue with the COVID-19 transmission is that it had been heavily concentrated in Java and it has been moving out to other regions as well. It has been, because of the social restrictions or PSBB, affecting urban areas in the first instance more than rural, but that is also changing as well. And so I think encouragingly from the government's perspective, there's been a lot of flexibility opened up in the way that village funds are operating to be able to meet local situation, flexibility to have cash transfers as part of the village funds. The school operating funds have also had more flexibility around ensuring that people have technology access. So the government's really recognised this need to respond locally to the situation as well. And whether that's time bound during the crisis or whether some of those good initiatives could continue going forward is a question which certainly be worth exploring further. I'll hand over to Bimbika to talk more about the Bansos Productive and Micro initiatives, but I'll also acknowledge that we've got our colleague and Titik Anas on the line as well, who can give a lot of insight on the area as well. So if Bu Titik, if you'd like to make any follow-up comments, please do.
Thank you so much, Melissa. I was going to propose the same actually, because Ibu Titik would have a lot more insights than we do. We, with a lot of our work has been just following the media announcements and listening to the webinars, and also discussing with colleagues, whereas Ibu Titik is really in the front line. So but you know, from our understanding, the question was, is 2.4 million national, or is it only Jakarta? I understand it's national, but Ibu Titik, please. And whether it's enough, especially for those who are running, you know, unproductive businesses in the first place. I think there's, you know, there are two issues here. There's the productivity issue. There is the welfare issue. My personal view, I would say, is that, you know, the welfare issue really needs to be at the center, because the market mechanisms that generally work are not working in this situation, and it's very difficult to distinguish who's productive and who's not. And our attempt at distinguishing that, you know, if you look into it, there are lots of caveats as well. But the earlier work is very interesting, is that even a small grant, especially businesses strapped, that are like facing a lot of difficulties, even in normal times, would go a long way towards supporting. And in our recommendations, if you look, we've actually gotten a series of 4 recommendations, bearing in mind those precise questions that you had. One is, of course, the one-off grant. The other is, you know, the loan top-up. And here we've suggested that, you know, the one thing that could be done is providing people with these capital grant letters that they can use as collaterals to access more loans if they need to, in the event that the one-off cash transfer isn't enough. And most importantly is the, you know, link with business support, especially for those in tourism industry, for instance, who, you know, that we know is going to be an industry that will take a really long time to recover. So, which is a time that, you know, people can't afford. So in the interim, what can be done, and here we think that the soft skills would be really important.
Thank you.
Yes, and Ibu Titik's question is a very good question. Should I take that, or?
I'll let Titi speak later in the next round. But first, Wita, do you want to have a brief comment on the questions? You're muted.
Yeah, just quick response about the labor market protection. So I think, yes, there are challenges, and often we miss the voice from the business sector. They are also facing tremendous pressure, so it makes it difficult for them to keep their operations. And the furlough and also layoff are unavoidable. So it's not as, I think there is no simple answer to this. So it requires approach from different facets. And also one thing that I would like to reiterate is the significance of gender norms that still plague women in their participation in the economy. So as long as their contributions are seen as the secondary to the household and also to the overall national economy, it's quite difficult. It will be difficult to solve these issues. So WSME is one of the key possibility of for the recovery, as they create jobs and also provides flexibilities. But again, the challenges will be on the protection and also the view that they are only secondary income earner.
Thank you, Wita. Ririn, quick response? No? Okay, so our next round consists of Titi Anas, Pak Budi Resosudarmo, and Bu Mei Ling Oi and Pipa from CHIPS. Can I invite Titi first? Titi?
Thank you, Acho. Great topics and great presentations by Melissa, Bimbika, Wita, and very excellent comments from Ariane. So on the issue of grant, the productive grants, so actually I was asking a question, but I think I can add a few things on what Bimbika has explained. It started from President's idea to give this productive grant to ultra micro entrepreneurs, so that they can restart the economy, their business once COVID-19 is managed. The idea is just to give the money to the entrepreneurs so that they can restart. However, some ideas from the PIC is the Ministry of Cooperative and SME in this case. So the idea is also going to kind of having pendampingan. So it's coaching or what is it, pendampingan in so that the business can be evaluated whether they can improve their scale or not. The issue, as I wrote in my comments, is that as you know, this ultra micro is not well registered, in a sense that we don't have their name, the data by name, by address, because it's ultra micro. Today they are here in business, but tomorrow probably not. So they are not in the business registry, majority of them. However, some are registered. So this is well covered. I think once you are registered in the system, it's well covered. So I think the challenge will be in distributing this grant is how to collect the more recipients, those that are still outside the registry system. So the question was, I think for all the people cares about the ultra micro here, I think the question is relevant. How we distribute the grant fast, but also accountable. The accountability is very important in, at least in the Indonesian system, where if you are not giving the fund to the eligible person, you are not going to be, you're going to be kind of having problem in the future, just not now, not only now, but also in the future. So accountability is a very important aspect of any social assistance or any disbursement of public funding. And so I think that's the big issue. I agree with what Bimbika has been suggested, that this money is going to be very useful for the recipient. I think that's my comment on the productive grant. I also would like to ask a question to Mbak Wita, if it's okay, Acho.
Ya, silakan.
On the social culture differences between women and men, that makes any non-discriminative treatment by either policy or firms is not relevant. My question is not relevant. I mean that because they are different in social culture perspective, it means you have to have different treatment basically. So if the employer said that, oh, we have same treatment to both women and male workers, it's not, it means that we are going to differentiate the impact to the to these two gender group. The question is that how do you see? I mean, how it best to mainstream or internalize the issue of social culture differences across gender so that the policy is more elevating for women, for example, in this case, because they are not, have same level with men in social culture perspective. Thank you.
Thank you, Mbak Titi. Mas Budi?
First of all, I would like to thank all the presenters for a very solid presentation. It was great to see all these survey result, which is very attractive. So my question related on how much your survey or your analysis has revealed the interlinkage between enterprises. So the main issue that I thought that certainly Mbak Titi might not be agree, but please respond to it, is that the Indonesian government might not have enough money to help everybody. So distributing pennies to everyone will not help everybody, will not help anybody. So clearly there needs to be strategy. And certainly what has been, been trying to people talk is that whether we need to just support a certain group, but that group actually has a strong interlinkage with the other group, so it could be supported. So for example, the people from Kadin say that, look, most of the micro enterprises are connected to people that working in the large enterprises, medium and large enterprises. They are all working surrounding the factory and so on and so on. So, and then you have a problem in identifying them, recording them and so on. But what you could ensure, as long as you keep the medium and large enterprise survive, there is big leakage to the small and enterprise. Well, people can disagree with that, but as a key. The other option, and on the other hand, you could actually give the money as much as possible to micro enterprises. They could survive, but then all the big companies are actually not working. So for example, there has been a debate whether state-owned enterprise like Garuda should receive capital investment injection that much. So, and the key to understand, to be able to resolve, is that what is it exactly these micro and small enterprises are linked to the other enterprises, and so we could understand if their link is small, then certainly the argument that you need to support the big one is not valid. But if the link is small, you got so much problem in distributing the funding to the micro enterprises, and you know that you do not have enough money, you might want to pick winner. So that is my question. Thank you.
Thank you, Mas Budi. Can I call Ibu Meiling? Ibu, you there? Yes, silakan, Bu.
Thank you, Ato.
To hear you, Bu.
Congratulations to everybody. Great presentations. I've enjoyed it very much so. Except, maybe I can tell you my experiences listening to all of you. Of course, partly is my age, okay? Much older than you are, including Pa Ato.
No, Ibu, you're still young, Bu.
The feeling I had was, when the COVID started, what happened in, especially Jakarta, okay? Jakarta people thought, my God, nobody can even eat. They're so poor, it's affecting everybody's life. There's no food for anybody. So what did women do? They were the ones who organized for food. Now, yesterday, and this happens also in neighborhoods. I'll tell you what's happening, and it's this dynamic which I think is really happening all over in different classes. I will tell you what I know in my neighborhood. Okay, so people were feeding others, especially the ojol and the small businesses, mainly on main roads. The ojol, of course, they could come and go. Okay, so just pick up food and then they go. Sometimes they get more than for themselves and they can feed then the rest of the family. So yesterday, one of our neighbors suggested, who would like to contribute so we can feed some people? No reaction. But if it's, can we help somebody else, then the whole neighborhood does. Okay, so it's this dynamic, this changing dynamic in Indonesia, which was not captured, which I found, it's continuously changing. It's not like a photo, whatever you were describing, okay? It is very dynamic, and how has it changed over time? That's, I think, is also worth recording. That's one. In between, can I say something about Terry's question? Because I'm afraid to forget. Terry, BKKBN operated the way they did in terms of microcredits and all that. They could do it. That was way before decentralization. Today, it's impossible. BKKBN tidak bunyi. They're just nowhere now. You know, they have an office here in Jakarta, but they cannot be as influential. Camcast, I also find hopeless with their data. I can't read the results, and you cannot get data from Camcast, okay? Even on the COVID. So I asked a person who gives me these beautiful colored graphs, how do you read that? And the answer is, I too can't read it. Okay, so how, as demographers, we thought the first variables are, of course, sex and age, and that was quite difficult in the data from Camcast, Terry. So I don't know where the problem lies with Camcast, but the data is not there. Now let me go back to this gender issue. One thing that I found could enrich your analysis is, women from when they grow up, they're taught to always multitask. And growing up and in the household, they have to do multitasking all their lives, okay? So talking about the labor market, when they get home, whether they're in the office or at home, they do have to think of their children also. Now, in some families, like, well, that includes me and, my ex-students and all that, we have, don't forget, we don't live in Australia, we live in Indonesia, in Jakarta, we can still afford household help, one. Two, my ex-students, they cannot live in the city anymore. So they live farther away from Jakarta. So on their way to work, they drop off their children at the grandparents. So that system, yes, it's in the unit where they live alone as a household. But the links are still there for some, not for all, okay? But for the middle class, that's very true. Now, what I thought is very interesting to me, what's happening today is, yes, it's true. A lot of them, quite likely, women are more affected. And the main reason to me is that women control the household funds. So if there's no money in the household, it's women. Men give the money to the wife. Pak Ato is there nodding. He gives the money to his wife and says, here, that's it. The rest is all your problem. So, you know, they can get from their husbands, let's say 100, but running the household costs 200, and it's really up to the women to find the other 100. Okay, so this is Indonesia, and that is how we run the house. So it's women, they have always had to borrow. Okay, that's what you forget. No, and then they have to pay. Okay, so they grow up like that. That women, it's women who have to borrow and pay back. Okay, and this is then missing when you analyze. Oh, they get money from the government, they have to repay it, or they don't. Now, men are great risk takers. Women are not, because they are stuck with all that. And don't forget, residential patterns with marriage is women live close to their mothers with high divorce, okay? So at divorce, the men go further and further away. And women stay close to their mothers. So this is then, you know, from generation to generation, that's what happens. So the girls learn from their mothers how they have to deal with life. So with the multitasking, what's happening with the COVID, I wish you could have covered it because, you know, I see it in my RT. This is technology. We're all connected to the WhatsApp. Okay.
Ibu Mei-Ling, thank you, Ibu. Sorry, I have to cut you.
Yeah, okay.
Because but thank you so much.
Sure.
That's really wonderful stories and compliment the presentation, Ibu Mei-Ling. Thank you so much. And because our time is actually up,
sure.
I will give just 1 minute to every speakers and discussion to respond. No, it's okay, Ibu. So 1 minute, Ririn, and then Wita, Bimbika, and then Melissa. Go ahead.
Thank you so much, Bu Mei-Ling. Actually, your question came up in the right time. This morning, we had a short piece of our article written by colleagues, including Dia Hadisetyo Naluri from LD. We look at a case study of urban informal food networks in Jakarta during COVID-19.
Where is this published, really?
In Melbourne Asia Review, and I think Ichut has put up the link on the chat for the rest of the participants. And we argue that the pandemic has highlighted the importance of informal food networks and the essential role that women play in creating, extending, amplifying, and sustaining these networks. We use this example of tukang sayur and WhatsApp organized by the ibu-ibu in a particular housing complex. So I really like your comment, and really interesting about living arrangement and how it would play out on across different families. Something that I would think about. Terima kasih.
Thank you, Ririn. Wita?
Yes, what Ibu Mei-Ling already mentioned is just the fact that the pandemic magnifies and amplifies the gender inequality in the household. So we see that it could be a setback, but on the other hand, could also be an opportunity to shift the gender dynamics in the household. So from the survey, you saw that men also feels overwhelmed with the extent of domestic responsibilities. So this is a good time to renegotiate and also shifting the balance in the household. And for the government and also from the employer sides, it's also becomes more critical to acknowledge that gender norms are really influencing all aspects of life, not only at the household level, but it also impacts up to the macro level. Thank you.
Thank you, Wita. Bimbika?
Thank you very much, Ibu, for these wonderful comments. I'm, personally speaking, I'm a believer that any sort of policy decisions that are introduced also need to have a feedback loop, and the examples that you gave of these very positive feedback, positive coping mechanisms are very important, because not just the case of Indonesia, but many contexts and countries. I think everywhere policymakers are struggling with the question of how to manage the pandemic, and you see this, as Viren said, comparatively speaking, you see it across from developing, emerging economy lines, and this kind of dialogue and feedback on the positive coping mechanisms that can be scaled out or scaled up are very essential to manage, to co-manage with citizens. Thank you.
Thank you, Bimbika. So last one, Melissa.
I'll just round out very quickly, Archo, on Budi's comment, noting that we haven't responded fully to Titik's question about quick and accountable disbursement, but we can follow up on that one. But on the issue of large and government expenditure reaching people, I think the approach has to be layered. It's such a fast-moving situation that we're in, and to the Indonesian government's credit, have responded to that. There are credit measures, tax concessions for large firms, and then all the way finding through that if that's not meeting the micro firms, looking at capital grants, and that to us is the right approach. There may be some streamlining and consolidation that would happen in recovery, but that can come once we're through the pandemic and can always be time bound. So that would be our comment there. And very important, of course, to consult with business and community as those measures are rolled out.
Well, thank you so much. This has been a wonderful session. So I cannot thank you more. Thanks also for all the participants. So now let me call Nuke to tell us what's coming next week. So over to you, Nuke.
Hi, John. Thanks. Next week, we will have John McCarthy from ANU, who will talk about food security during the pandemic. John will speak with his team. I think that's all. Thank you. And we're going to close this.
Thank you, everyone.
Thank you for everyone. And recording will be available at www.covid19indonesia.net.